Welcome back, friends. So listen, lots of adults are using GLP-1s to manage their weight and deal with chronic conditions like obesity and being overweight. But the question is, where do minors come into the conversation when it comes to GLP-1s and using that to help them lose weight? We are talking about that right now. Back in our LCMC Health Wellness Lounge is Dr. Anthony Hudson, a pediatrician with Manning Family Children's. Thank you again for sticking around to talk about this. Okay, this is interesting because, right, all of us know somebody who may be using a GLP-1, but they're over the age of 18. I'm curious, in your practice right now, are you finding more parents coming up to you and asking about GLP-1s and their children?
So as we've spoken earlier, with increasing rates of obesity in both the adult and pediatric population, yes, more people are coming into clinic asking their pediatricians about therapy for their children.
Wow, that is unbelievable to me. And for people who may not know how a GLP-1 works, explain what happens when they take the shot, or I believe there's like an oral option now too.
So GLP-1s initially were isolated from the spit of a Gila monster, and we found that this particular protein mimics glucagon, which has a variety of roles in metabolism of sugar, satiety, just generally being able to sit still and feel full.
Wow, and when someone takes it, it's slowing down their digestive system as well?
It does. It slows down the peristalsis, or the squeezing of the stomach, the emptying of the stomach, so you do feel full for longer periods of time with smaller amounts of calories.
This is interesting. And when it comes to kids and GLP-1s, what does the American Academy of Pediatrics recommend?
So for children 12 and up, with a BMI greater than the 95th percentile, it is approved for treatment for obesity.
Wow, that is unbelievable to me. And I'm so curious, who is the candidate for this? Obviously somebody who's obese, right? When does the doctor then step in and say, hey, they can be a candidate for this?
So our first step would be to educate the family, try to help them out, maybe more from a cultural perspective, or help them at home. There's a variety of different things to address with the family, again, whether it's their access to food, how they can prepare food, store food, do they live in a food desert? But as you're moving along with therapy and seeing them over multiple visits, eventually a GLP-1 does come into the conversation. Again, these would be for kids 12 and up that have already failed lifestyle modifications.
And people need to understand that this is not a standalone solution, right? It's something that can help on their journey to becoming an acceptable weight. What are some of the other things, like you mentioned, lifestyle modifications, that parents need to understand that even if you get your child on a GLP-1, you need to also be thinking about these things as well?
Yeah, so the medical toolbox to treat obesity is very limited. GLP-1s are new on the scene for treating obesity, not necessarily type 2 diabetes, but it is new on the scene for treating obesity. But it is a great tool to use. Outside of that, it would be more ideal to look at this more from a cultural perspective, again, educating families from the very beginning, going to birth classes at the hospital where we're learning about delivery, but also at that same time educating families about what they should be eating during pregnancy. And then I think having the pediatrician continue to educate the family on a age-specific level as they're growing about how to approach food, how to approach picky eating, how to teach children about shopping and cooking food, growing food.
Healthy habits.
Yeah, healthy habits in general.
And it's so important that we know about the healthy habits. Like we talked about earlier, put down the drinks. The drinks is what's hurting our kids the most, myself included. Put down the sweet tea, because that high fructose corn syrup is not helping anyone out. But I gotta ask you this, doctor, because listen, kids might see their parents taking the GLP-1, right? They see them taking the shot, taking the oral medication, whichever one they choose. But they also need to understand that there are some risks and side effects when it comes to GLP-1s in adults and in minors as well.
Yeah, I think you're speaking to the social implications of having a chronic medical condition here?
Not necessarily. Like, say someone is taking like a GLP-1, right? I know nausea, vomiting, all that can be a side effect.
Yes, I'm sorry, I misunderstood your question.
But I have a
Yes,
question about that too, yeah.
So some of the common side effects exactly are going to be gastrointestinal related. So as we spoke to earlier, we're slowing down the stomach in essence with these medications. So things like nausea, vomiting, constipation would all be some of your more common side effects.
It's so important. And I was talking to him during the commercial break because I wanted to ask him this, because I feel like, say your child does get on GLP-1, right? During the school year, their parents are going to start to notice that, and their students rather, and fellow classmates are going to notice that they have all of this weight loss. How does a child communicate to their classmates, I may be using this?
Yeah,
I feel like they might get bullied.
Again, having a chronic medical condition can be difficult for children. This really could potentially set them apart from some of their peers. Things that come to mind would be asthma, type 1 diabetes, where a child is using a medicine frequently out in the open, whether they're counting carbs for lunch or using their inhaler before PE class. This is going to start at home, where parents should educate their children, make them feel comfortable with what's going on, and then having the pediatrician also give them some tools to use when they're having conversations with their friends, to educate them so they can say the appropriate things.
It's so important that we have conversations like this, and remember, it is a tool to help them on their journey. There's nothing wrong with it. They're just trying to get to an acceptable weight. Doctor, thank you so much for joining us today. As always, and look, everybody, for more information about how Manning Family Children's can help you, manningchildrens.org.